World Sickle Cell Awareness Day 2018. The General Assembly of the United Nations passed a regulation dating June 19 as the World Sickle Cell Awareness Day, held annually starting in 2009. Then it has served as a way to increase awareness. It's a way to elevate awareness of this worldwide public health concern and the struggles that those with sickle cell disease and their family pass through. This year, Sickle Cell Disease Awareness Day, yes, for this year, the community-based organization are organizing and gathering across the world while celebrating diseases, while celebrating this cell disease. They are shining the light on sickle cell disease, shining the light to make awareness, elevate awareness of this serious public health concern affecting more than 100 million people, around the world. So, community support for women and girl child empowerment initiative, as part of our aims to support and place priority on vulnerable people and community. Okay? We are using these day, yes, increase and elevate awareness. We are also using this day to build support. We are using this day to build network support, raise critical resources, and also to strengthen our collective self to advocate for access to particular disease. So, disease. We'll be right back. I'm your host, Esther Odunayo Olaoluwaremi.
Thank you very much. I'm honored to be a guest in this program today to mark this year's World Awareness Day for Sickle Cell Anemia. It's a global problem, a worldwide problem that is really taking its toll on so many lives, and it's strongly rooted on ignorance, I believe, because it's something that is very preventable. If due diligence is taken into consideration, it's possible to actually prevent the sufferings that these individuals go through, including their families as well. Sickle cell anemia is a medical condition which is resultant from disorder in the blood cells, which leads to easy breakdown of blood cells and manifests as multiple and varied clinical conditions depending on the systems where the problems becomes affected. Like I said, it's a blood disorder. It's a genetic condition. It can be passed on from parents to their offspring, and it mainly affects the blood cells, the red blood cells. What it does is that it causes the red cells to take the shape of a sickle. A sickle is something that is used to harvest rice and grains and all those. It looks like a C shape, kind of. So a blood cell is supposed to be just like a saucer, all right, but it now sickles changes its shape to that of a sickle because of this disorder that happens inside the genetic makeup of such individuals. Now, worldwide, over 1 million people or so suffer from this condition. But I'd like to say that it's commoner among the blacks. All right, globally, it's known to be more common with the blacks. So it's our issue. It's something that it's with us for a long time. In those days, our forefathers, they used to call people like that Abiku or Manje and so on. Those are the things that used to make them suffer and die, and so it means it has been there with us all the way. Can get of the blockage that happens in those vessels. So if it happens in the lungs, for instance, we can have what is called acute chest syndrome, in which you have serious pain in the chest because there's blockage of blood supply to the lungs. Okay, it can affect bones, it can affect the brain, it can affect kidneys, it can affect virtually all organs, including the intestines, can be affected one way or the other because of this simple mechanism of the blood vessels being blocked by sickle cells. All right, so this quite early in the person's life, usually in infant stage, within the first 6 months or so, the condition can present with the child having pain in the joints, in the hand and the leg, what is called hand and leg syndrome, hand and foot syndrome. So the child will have pain in the hand, pain in the feet, and if you look at them critically, you may see that they may form things like there may be swellings in those small bones of the child. All right, it's quite painful and very excruciating. So from there on, that child will never live a normal life because little stress will cause the blood cells to sickle. And when they sickle, the body removes them, the body destroys them, leading to anemia. It takes about 120 days or so for blood cells to be replenished. But their blood cells are destroyed before it gets to that period. So they have a shortage. That's what anemia means. Anemia means shortage of blood cells. Okay, so when that happens, the condition, the lack of blood worsens the situation. So you see people who have such things, they have to keep getting transfusions to stay alive. All right. So it has varied multiple complications that can affect all this body. It can, like I said earlier, it's preventable. All right. If parents are properly paired, avoiding people who have the traits, sickle cell trait condition, are people who are carriers of the condition. If they avoid marrying themselves, it can actually be prevented from happening in the first instance. This is one of the cases where prevention is actually better than cure, because it cannot be cured permanently. Only recently that there's hope for cure, now that there's issue of bone marrow transplant, although it's still new and very expensive and not easily available. So
thank you very, very much.
you're welcome. Yeah.
Thank you so, so much. This is educative. And before I move on, I would like to introduce one of our fathers in the building and also one of our sisters. I have in the building Pastor Olushola Kalaye, and I have also one of my own sister in the building. You're welcome, sir, and you're welcome, ma'am. Thank you very much, sir. You define sickle cell. You said sickle cell is a disease, like a disease. And sickle cell disease is a red blood cell. That's a red blood cell that is inherited, according to your definition, inherited blood disorder. Now, in the community today, statistics shows that Nigeria is one of the highest country that this particular disease is seen. It is seen in Nigeria. That they said in every 300,000 children in Africa, in Nigeria we have up to 150,000, according to statistics. We have 150,000 children daily with sickle cell disease. Now, is it that the community, is it that the country, they don't know about, they are not aware about this disease, or people just go into marriage without checking their blood group, sir?
Well, one of the ways of preventing it is massive public enlightenment. So if it's still occurring, it means that the enlightenment is not enough yet. Okay, I don't want to say that people don't practice what they are doing. I think it's because they don't know yet enough. They don't know the implication of the choices they make, in not avoiding people who are carriers of the trait when they marry, because the enlightenment is not massive enough yet for people to get informed. In our village, how many times do you see adverts on the TV? It's rare. The enlightenment is not enough. But people who have just one patient of sickle cell disease in their family, it disrupts the family dynamism. It disrupts the stability of the family. It disrupts, and they are not even sure that that child will grow up to become an adult. Yes, Nigeria has the highest bulk. Why? Because Nigeria is the largest black nation in the world, and we said it is commoner with the blacks. So obviously, Nigeria should have the biggest concentration of people with such disease.
Now, I have a question here for you. Can this sickle cell disease be cured?
Yes and no. No, because it cannot be cured by any known medication. All right? But yes, recently there is a promise of replacing the bone marrow of the person who has this disease, because the blood cells are formed in the bone marrows. Okay, so the person who has the problem has already inherited abnormal blood cell formation system. So all the blood cells formed by that person will be abnormal, the red blood cells particularly. So if there is another way to introduce a transplant, like a transplant of another person who is normal, transplant their bone marrow into this person, this disease blood person's the patient who has this problem, then if there is a way to sustain that bone marrow that is transplanted now to start working and replicating, it will replicate based on the original source, the genetic makeup of the person who is donating it. So in that case, the bone marrows, the cells that are formed from there will all be normal. So that's the new science that can actually cure it.
That means it will be normal.
Yes, the person can become normal if the new transplant takes and survives. The person will be not become will be able to produce normal cells. That's the problem. Once you have normal, the person has normal cells, the person will be okay.
That's a great one there, but they say prevention is better than cure, right?
Yes,
Prevention
far
is
better.
better than cure. I also have a question for you here this afternoon, sir. He said, what are the signs and symptoms? What are the signs, sorry, and symptoms of medical conditions
Of this
can be
condition,
linked
okay.
to sickle anemia, and at what age does these symptoms typically start? You know, normally they will tell you if a child is sick, if that child is sick, maybe in a week, and another week the child falls sick again. The child, they say, people say in the layman's language, it's like an SS. This child is an SS. So, what are the symptoms? What are the signs that we can know that the child is a carrier of this disease?
Well, the symptoms manifest quite early in life, up to about 6 months. The reason is because the blood cells that the child is born with, what is called fetal hemoglobin, those cells can hold oxygen. So early in life, before the first 6 months, it's not likely to see that symptom because that fetal hemoglobin will be able to sustain the child. But beyond that time, the need for more oxygen will come up. So these abnormal sickle cells now, abnormal cells, will no longer be able to hold the oxygen that the child needs. So from about 6 months, symptoms begin to manifest. And they will manifest based on the organ system that is involved. The first thing you see is pain. Pain in the hands, pain in the joints of the legs, the feet are usually the first thing to manifest. You may also see anemia. That means jaundice. All right. Jaundice is yellowness of the eyes, the mouth, the eyes. In a young child, you can see it on the skin, but for older people like us, you cannot see jaundice on the skin. For a black, person, all right. So yellowness of the eyes and skin, pain, depending on the organ involved. It can be in the chest, it can be in the tummy, if the intestines are involved. If it's in the spleen, depending on what organ, the liver, it can manifest in all those. The kidneys can fail because of low blood supply to it, where you have the child not producing enough urine. All those are problems, okay, depending on the organ system. But the commonest ones are the issue of the pain, the issue of not having enough blood, because if blood is sickled, the body system eradicates them. So you have shortage of blood. They can feel dizzy. They can feel easily fatigued. They easily get tired. They can't move around without getting tired and exhausted. Those are the symptoms you see earlier as the child grows.
Thank you very, very much, sir. They say the normal blood donut and those with the class, like a Christian, um, like a Christian, oxygen to pass through the Okay. And I have a question for you here. Caution. Someone said some people believe that people with sickle cell are just being lazy, but in reality, they go through what is called pain crisis. Can our can What is this pain crisis? Come again, Vasu.
normally occurs in the bone. Okay, if the bone cannot get enough blood, that bone will undergo necrosis. That means the bone will disintegrate and die. Okay, so you have a bone that the person didn't have anything, but suddenly the bone is dead. The bone will not grow again, and the person may have deformity. When you look at the finger, you see one finger is shorter than the other because of that crisis. Nothing happened, just unexplained. You notice that one finger is shorter than the other because of that. The bone has died, cannot grow again. Okay, so it can happen to any other organ, even the brain can have stroke because of vascular crisis. So basically, that's why people who have sickle cell disease go through such pain. It's not their making. If they stay in a place where there's low oxygen, it worsens their condition. If there's a low oxygen supply, maybe in a crowded place, it can worsen it. If they get
like the asthmatic patient.
Well, not exactly. The asthmatic patient reacts to something, but the anemic person does not react to anything. He just doesn't have enough oxygen. So even in a normal setting, the cells cannot hold enough oxygen. You cannot imagine what will happen when the oxygen is not enough. Alright, so they suffer shortage, and that typically triggers the crisis that they will go through. So if they experience high pressure condition, like if they fly, for instance, just flying can make somebody with sickle cell disease to experience crisis. Staying in a crowded place can make them experience crisis. If the weather is too hot, can experience crisis. The weather is too cold, can experience crisis. Just extremes of weather alone. So if weather changes to cold or to hot, they will experience crisis. They go through a place that is dusty or stressful. If they go through stressful academic condition, they will experience crisis. So yes, any stressful condition that increases the demand for oxygen can trigger a crisis for them. So that's how terrible the condition is.
Thank you very much, sir. For me, this is truly educating because I never knew a blood cell is round or crescent. I'm just getting to know today because I'm an art student. I'm not a science student, but this is really, really educating. I would like to appreciate you, Doctor, for this talk. And how can we cope with these people?
Well, there are two phases to it, right? Prevention is the key. The other one is to understand that not to stigmatize against people who have this crisis. Because if you are to stigmatize, you should actually stigmatize their parents. Because they are people who brought them into the issue. They didn't make any choice about it's an inherited condition. Okay, so how is it inherited? Someone who is a carrier who has one normal chromosome and a normal one normal gene and a abnormal gene, the person will not have symptoms naturally, but the person can pass it on to their children. Okay, so if two adults, male, female, who are carriers, get married, they have a 25% chance of giving birth to a child who will be a sickle cell disease person, right? And on that 25% chance of having normal children, and that then 50% chance that their children will be carriers also. Okay, so that condition of two children. Okay. So they have the condition occurs that they have children who have both genes as abnormal genes. Then you have full-blown sickle cell disease. So the education should be on counseling and testing before marriage. Okay, all people who intend to get married, should get themselves tested whether they are sickle cell trait carriers, and if they are, the best thing for them to do is not to go ahead and get married, because there is a high risk that they will either have traits. They have 75% risk that they will either have sickle cell traits and sickle cell disease. 50% for traits as carriers, and 25% that their children will have the disease. It doesn't mean that out of 4 it's only 1. It could be all the 4. It's just the risk for every pregnancy. The risk is 25%. So if the 25% will come out 5 times, they will have 5 children who are disease, the sickle cell disease patients, and that's very disastrous because it can be a very expensive thing to manage. But if they're able to avoid stressful conditions, low oxygen states, low pressure, or low pressure states. Low pressure states are when you go up mountainous place or when you fly. Those things can, even pregnancies. Pregnancy is another one for ladies. Pregnancy is a stressful condition, we all know. So it's enough to trigger crisis. In fact, management of sickle cell patients in pregnancy is a very, very difficult thing. Only God helps them to survive many times. All right, if they don't have good, medical facilities available. All right, and we live in the third world in Nigeria. Many of our people live in rural areas, so you can understand the risk they will go through if they have such conditions where they will not have good medical facilities and people who have enough knowledge to take them. Family members may not really understand how difficult it is. Okay, so that's why the problem keeps getting worse and worse. And then stigmatization. People don't need to stigmatize them. It's not something you can get from touching somebody or living with them or relating with them. No, it's a genetic condition. It only has to go through genetic inheritance.
Thank you very much, Doctor. I think that is why they call you one of the best in the Northeast, because with this explanation, a layman can get this words easily. I want to appreciate you, sir. Aside that today is World Sickle Cell Disease Awareness Day, today is also a Father's Day. I celebrate you, sir.
Thank you.
And we also have one of our fathers in the building. Daddy, happy Father's Day to you. Today is World Sickle Cell Day, and we would like to get your fatherly advice towards this particular topic on this discussion, sickle cell disease. What is your advice to those that are getting married, sir?
Thank you very much for having me here. Sincerely, I appreciate our doctor for this, for enlightening us on the sickle cell. At times, whenever we have single sisters and brothers that comes around to tell us their mind of coming together as husband and wife, we usually ask them to go for a blood test. It is very, very important for a brother and a sister who want to get married, just as the doctor have rightly said. It's always important for them to know their genotype before they will go into it. Especially if a brother is AS and a sister is also AS. We always want to discourage their coming together because there is possibility of them start having children with sickle cell anemia. So that is why we always encourage them. It's not because the church don't want them to come together as husband and wife, but the church want to try all we could to ensure we did not discourage or we did not start promoting the disease. So that is why we always encourage them to do that, because we believe that it is not something that is right for us to ask them to go ahead. In fact, at times we go to a certain level to ensure that, okay, if a brother and a sister comes around that they want to get married, even after they have the understanding of their genotype, the brother know, yes, he is AS, the sister also know she's AS, and maybe because of love, no, I love this person, we just need to go together in this journey. We just tell them, before there's going to be any joining, there is need for us to invite their parents. We will invite the parent of the sister, invite the parent of the brother, ask them, okay, you know the genotype of your daughter, you know the genotype of your son, and they are saying they want to get married. As a church, we don't want to promote something they will eventually regret. But if both families said we are aware, we want them to continue, fine, the church will not be blamed thereafter. So, but I think the best thing, according to what the doctor have said this afternoon, the best thing is just to prevent it from happening. Because at the end of the day, by the time crisis started, this thing we call love will just disappear into the thin air. Because by the time you discover all your resources is being spent on a particular child, and God forbid, just as he rightly said, out of 4 children and you discover all the 4 children are sickle cell patients, then
That is so bad, sir.
you just discover the money that you're supposed to use to at least do something reasonable will be spent on them. And at the end of the day, those children may not even live to take good care of you after you have spent so much on them. So the best thing is just to prevent it from happening. Fine, love is there, good, but there is need for us to take caution. Then at the same time, being a pastor, I know there are people who want to prove to us that they have faith. In fact, I've seen somebody, a brother, who came to me and said, Pastor, does it mean the church is not preaching faith any longer? Where is the role of faith in a thing like this? And I do tell them, it's not that the church doesn't have faith, but we only want to guide against something that one may live to regret in the future. Fine, your faith may work and it may not work for you. I've seen cases whereby we have 2 people like that got married. Both of them are AS. The first 3 children they are not carrier, but the last one becomes the carrier. So I pray that God will help us.
Thank you very much, sir. Thank you. Thank you, sir. And we also have a sister in the building, Miss Serewape. Ma, I would like you to come in from the angle of, Daddy has spoken. He talked from the father's angle. So help us chip in some things from the sister, the mother's angle.
Okay. Advise our sisters and brothers as they love each other. Let's look out for the right thing to do. Let's make sure we check our genotypes and make sure we match ourselves rightly to prevent us from raising children that might end up hating us at the end. Because there is a story of a child that hated his mother and his father because they married each other and brought him into the world because he became a sickler and he suffered. So my advice is we check our genotype and match correctly and get to take advice from our doctors and parents that advise us. Thank you.
Thank you very much. We have a question in the building, but before I go to that, Daddy talked about faith. And I want to tell our audience, if your faith do not carry you, please just separate. Leave that sister, allow that brother go. And also our sister said, don't bring a child that will hate you into the world. Every child loves, and they love correctly. Please avoid that marriage. Avoid, prevention is better than cure. Prevent it now. Thank you very much, ma. The question from, we have a mother, she just came in, Mrs. Confidence. You're welcome, ma. She have a question, and I don't know who this question is going to. Is it a doctor or a daddy? Or
To the doctor. All right.
Okay.
Thank you so much. Thank you, doctor. Thank you, daddy. Once again, happy Father's Day. My question goes to the doctor. I want to know, is there a way of
and dictating sickle cell baby in the womb, maybe before giving birth to that child, is there a way of dictating that disease in that child?
Yes, it is possible to detect if a child is a carrier of the genotype of the defective gene. That's a genetic testing. You have to do a DNA analysis of the person. It's possible to do that, but it's expensive and it's not easily available. So that is the danger, right? So in my village, for instance, it's not available. In Taraba State, it's not available. In Nigeria, probably 2 centers, maybe one in Lagos. I know there's one in Lagos, I think at Abuja. So you see, it's not easily available, and then it's expensive. Maybe you may spend up to maybe 200 to 500,000 for each of these tests. So you see, it's not something that is so common or so easily available. And then you would need to take a sample of the baby inside the uterus. That procedure is not also easily accessible for all. You cannot just walk to a health center now and ask them to do that test for you, because they don't have the skill to take something from a baby inside the uterus. All right, it requires expert attention. So, and those are high scientific procedures that will require you having to go to Lagos or to Abuja yourself, the woman with the baby. Okay, so that's one thing. But yes, it's possible to do that test. It's not easy to do it just like you do a genotype. You cannot do a genotype test, because when you try to do a genotype test, it may not be positive. The kind of blood the baby is carrying can hold oxygen. It doesn't sickle. All right, until about 5-6 months, when that blood has been replaced by the more permanent blood. Just like a child, when the child first tooths, the teeth that comes out is temporary. After a while they fall away and the permanent one will come up. Is it not so? That's how it is. The baby comes out with fetal hemoglobin. That hemoglobin the baby comes with is the one he used to survive inside the womb. Inside the womb there's no breathing. Is it not so? And so there's a special blood that the baby has. It can attract oxygen when it's in a scarce environment. Okay, so but that one can survive. If you do a sequencing test, it will not show you until when the body now replaces that blood with the normal blood that the baby has. Then that one will be that's when you start seeing symptoms appearing, because that permanent one that now comes now, it has that defect. Right. So the way to test it in utero is to do a DNA analysis, and that's the one that is not so common. Welcome.
Thank you very much, sir. We have one of our sisters also in the building. Her name is Miss Mabel, and she would like to ask you a question, sir.
Okay. Good afternoon, everyone. Thank you, doctor, for the plenty information that has come forth. It's actually from a very deep well. So I want to ask, is there life expectancy for people who have sickle cell disease? Because some people feel like, okay, they can't live more than 20 years. We've seen some people live even up to their 50s. So is there a life expectancy before?
So I get your question. You're asking what the life expectancy is for someone who has sickle cell disease. When I was a medical student, the first time I saw an old woman that is a sickler, she was a grandmother at that time. So when she came to the clinic, I was surprised, because I used to think that somebody cannot live more than 20 years too. But I saw this old woman, she was looking better than my mother and better than everybody I know. So with good care, people can actually live long. All right, with good care, people can live long if they avoid triggers, things that can trigger, their crisis. All right, and quickly get medical attention when the crisis is about to start. Okay, so if they can do that with good nutrition, avoidance of triggers, and good care generally, and good support system, they will be able to live long. I also had a friend. He was a medical student. Maybe somebody who has that class should not be a medical student because it's a stressful course of study. All right. So it was in his final year. I'm sure he couldn't cope anymore, and then we lost him. All right. So you need to avoid stressful things. Someone who is sickle should not go for NYC, far away from home. You should be in a place where people already understands your health history. Okay, so that if you have anything, if you come to the hospital, people already know that this is the problem and they know what to do. You shouldn't go to a place that they are also asking who are you. No, that's not a good thing to do, because you have to try to do DNA test. You have to begin everything afresh. There is no time. Before they finish doing everything afresh, the person would have died. Okay, so that's why the person doesn't need to be far away from the regular health service that they get. Okay, so those if you take those things into consideration, yes, life expectancy is fairly okay, depending on the management of the condition that happens. But if there's poor management, life expectancy is very short.
Okay. Thank you very much, sir. I think I have another question. So, for a sickle cell lady, does it have anything to do with not being able to reproduce? Yes, like you can't carry a child to full term, you can't have babies, or is it a result why you keep having miscarriages? Some people can usually attribute it to the fact that, okay, she's sickle cell, that's why she cannot carry her child to preterm, that's why she's always having miscarriages.
Sickle cell disease is a blood disease. It has nothing to do with the womb.
Okay.
So the womb is perfectly normal. Her reproductive system is perfectly normal. There's nothing wrong. She can get pregnant. The problem is that pregnancy is stressful. That is the problem. You understand? Pregnancy is stressful, and she doesn't need stress. You see the challenge? She's perfectly okay. She can get pregnant. She can carry a baby to term, but the pregnancy itself is stressful. Delivering is stressful, and she needs to avoid stressful conditions. But in a good hand, good health facility, they can do a lot to prevent. Maybe try for her not to, it's challenging even in a good hand to manage the condition is difficult. All right, because she can also there is increased risk that the woman can develop blood clots. The blood of sickle clots quickly. Okay, and that is a problem that can lead to, if blood clots, it can break away and go and block vessels. All right, so that again is a problem. Pregnancy can cause anemia. Sickle cell disease is an anemic condition. You see, so you have fire, then you add kerosene on it. So that's what it is like. All right, so that's why they are in a higher condition, higher risk for death in pregnancy. It's not because they are not able to carry pregnancy, but because they have a condition that already does not need stress, that's already predisposing them to anemia and all the other problems that they can have. So you now have a pregnancy state which aggravates this stress. So it's a big challenge for women who have this disease to get pregnant and carry to term and deliver. Okay, so basically that is the issue. That's what.
Oh, okay, thank you. Sorry, sir. My question is, does genotype and blood group rhesus factor has anything to do with sickle cell?
Yes, genotype is the testing of the gene component of for sickle cell disease. It's a common name for the common test. So in genotype we have two types of gene, the A gene and the S gene. Okay, so if somebody has the A is the normal, the S is the sickle gene. So somebody can either be AA every person has two types of gene for all kinds of traits. Let's say, for instance, the gene for dark hair will be two. One is probably white, the other one is black. If you have two black, you will have black. If you have two white, your hair may probably be white, or you may not be able to form the pigment that makes your hair black. Okay, like people who have albinism, sometimes it's a problem with the genetic condition. Okay, so in this case of the sickle cell condition, you have the A gene and the S gene. So if somebody has AA, the person is perfectly normal. He doesn't have a trait. He doesn't have a disease. The person has AS. The person has a trait. That person will not manifest symptoms except on very rare conditions. Be conditions of very low oxygen condition availability, but hardly do they manifest any condition. All right. Then you have another person who has two S genes, so SS. That person is a sickle cell disease person. All right. So, but the issue of the rhesus factor. Rhesus factor is mainly in terms of clotting, whether the blood will clot or not clot. Okay, it's not primarily related to sickle cell condition. But sickle cell condition is not just one thing. There are other types of cells abnormalities that may make someone who has sickle cell condition to even be a little bit stable. For instance, we said that the baby does not suffer from, the baby before 6 months does not suffer from the crisis. Is it not so? That's because the fetal hemoglobin is available, and that kind of assists in a way. Okay, so if there's a condition that makes that fetal hemoglobin to stay longer, maybe to 20 years or 30 years, for instance, it means that the person will be protected in a way because of the presence of that fetal hemoglobin. So there are conditions that can make other types of hemoglobin to be available also, although they are rare, so that the person who is a sickler may not frequently, fall into crisis because of the presence of those other abnormal, we would say, but it has now helped them to survive. Okay, so rhesus factor is nothing. It has nothing to do to predict whether somebody will be in crisis or not, but it has to do with clotting. Okay, whether blood supply will be compatible when you transfuse them, and it has to be checked if you are transfusing somebody to know whether the blood is compatible or not in terms of transfusion of blood. Okay, but not in terms of whether the person will come out to have offspring who are sicklers or not. I don't know whether that clarifies.
Okay, sorry. So if rhesus factor has something to do with clothing, that means there should be particular persons with particular rhesus factor that shouldn't be married to someone with issue of sickle cell, right?
No, that is not the way we see it. Rhesus factor is, what is important is, you cannot just carry somebody's blood now and give to another person. Blood is blood, is it not so? So it appears, but it's not really so. There has to be typing. Your blood has to be compatible with mine for me to receive your blood. If it's not compatible, my system will destroy the blood. All right? So the rhesus system is a way that it's used. Now, there is another system, the ABO compatibility. It's another blood grouping system. So if your blood group is blood group A or AB, the genotype system is A and S. It's not AB and O. ABO is blood. AS and SS is genotyping. Okay? So blood grouping, we talk about blood group AB, blood group O. Okay? So these differences will affect who can receive blood from who. For instance, the person who is blood group A, okay, he can only receive blood from another blood group A. Somebody who is blood group O cannot receive blood from anybody else except O. Okay, but he can give to all blood groups. Then somebody who is AB cannot give anybody else, but can receive from everybody. No, no, no. It's not. Essence has nothing to do with it, whether you can give or not. Okay. So the person that cannot give to any other person is AB. Only he can only give to AB. I'm AB, for instance. So I'm a. I can receive from everybody, but I can only give to another AB person. All right. That's because of the gene that the red cells carry. So the person who has AB has both the A and the B gene. Antigen rather. So if you give to somebody else, like if I give blood to a B person, the person has antibodies for A. Is B, he has antibodies for A. So the system will destroy the blood that I've just given to him. Okay, so that's for grouping and cross matching. That's what affects. But in terms of sickle cell, it has nothing to do with ABO or resource system. It's a different system, which is the genotype system, the A and the S gene. Okay, so they are not. It doesn't. It's not. There's no say. This person is a. It should not. In terms of sickle cell, it's just the genotypes, whether it is AA or AS. That's what matters, not the resource, not the ABO. That one is different. I don't know whether that is clear. Okay, man.
All right. Thank you so much, sir. Before coming, I had a brief discussion with my older daughter because she's actually having a friend that is sickle cell, and each time she fell sick, she usually come back home sad. She was like, "Mommy, my friend is not feeling fine. She's in the hospital and all that. I will have to go and visit her friend." And she was telling me that, "Mommy, do you know that someone can be totally free from the sickle cell?"
But it will not make it. It will not cure the person that way. What your daughter is thinking about is something we call exchange blood transfusion. That means you can actually exchange another person's blood almost completely with fresh, different blood. But see the catch here. The problem is a genetic problem. That means the machine that produces blood, let me use the word machine, the manufacturer of blood, will still produce the abnormal one, even if you remove all the blood in the system. The new sets that we produce will still be abnormal. So the way to achieve that is if you change that machine. That means that's what is called the bone marrow transplant now. If you remove the bone marrow, first of all, eradicate them, okay, and then replace with a new set of bone marrow. That means you have changed the factory or the machines that manufacture the red cells, so that the new one they will now produce when you have changed the bone marrow will now be normal cells. That's the only way it can be cured. All right. So, but in that case, you have to wipe out through maybe irradiation, something that can destroy the initial bone marrow of the person. Okay, but just exchanging the blood will not suffice. No. Yeah.
I don't know if we have any other question for our doctor, because we'll be wrapping up now. Our doctor, I really appreciate you. Thank you for coming, sir. Thank you, our daddy, for coming too. Thank you, Pastor Olushola Falaye. Thank you. Thank you, Miss Sewe. Thank you, Miss Confidence. And Mama Mabel, thank you very much for making this session an interesting one. For more information for the audience, we can all go to our official handle on Facebook, on Instagram, and on TikTok, which is official support 4G, as in 4G, 4WG. Official support, I take it again, 4WG. Yes. sickle cell anemia, sickle cell disease. This is education here. For me, I've learned a lot, and I know our audience have really learned a lot with the questions and also with the way our doctor reply with the layman language. So sickle cell is a sickle cell disease is not a death sentence. So far, so for people that are having the disease and the carriers of the threat, we want to do something. We encourage them to think positively about their condition and believe that they can achieve whatever dreams they have, because definitely we have people that are going through this particular disease right now. We have 4 million people all over the world. We have up to 40,000 sufferers of this disease. Yes.
Over that.
Yes.
Over
that. Wow. Over that, all over the world. What we want to tell you this afternoon is that these people are warrior loads. Yes, they are warrior loads. Let's cope with them. Let's help them. Let's encourage them. They are warrior loads for them to go through all this. Thank you very much.